Normally, younger patients come with different complaints than older ones. I mean, older ones, they come asking you, I want to look younger. Younger patients come and they tell you, I want to look fresher or better. The main concern about younger patients is that they don't want to be overdone. They don't want to look like inflated with big cheeks, with big lips. They usually tend to have natural results. In the younger patients, usually the first complaint is nasolabial fold, because as we know, with loss of weight and deflation of the upper part, we have migration and collection of nasolabial folds. So the first complaint, they come wanting to fill the nasolabial folds and the tear trough. Then comes the complaint, which is filling the lips, and this one it's not, I mean, an indication to be done for everyone. This is a demand the patient asks for. I mean, there's no rule, what's the normal lip? There's a rule, what do you like your lips to look like? And I have many patients who are young now seeking to have fuller lips because what they see in the media, on Instagram, on Facebook for actors and so on. So they tend to have fuller lips now. And lately we have many young people asking for more jaw definition. Also it's because of affection of social media. They see these models with square mandibles, so they ask for fillers for the cheek area, for the chin area, and for the mandible too. That all depends on the way the patient ages and on the way of the form of the younger patient. Younger patients tend to ask for little difference. They don't want a big amount of filler to be done. They don't want to look natural. They want to look the same as they are, but fresher. While the older one, the main complaint is sagging of skin. So if we're not doing lifting of the skin by surgical or by non-surgical method, we're doing it by fillers. So we try to fill the cheeks to have a bit of lifting, to fill the marionette lines, to fill the temples in the bigger age group. While in the young age group, mainly cheekbones are essential to look like more wide, let's say, and the nasolabial folds. That's for the younger patients. Some, yes, of course, like just Patrick mentioned, bruising and swelling. It's more common in patients take aspirin, taking some anticoagulants, while younger patients usually they do not take these medicines. The type of skin also affects for bruises. The rest of the complications, the vascular ones, the blindness, necrosis, they are less common. They are not affected, in my opinion, with age. They are more affected with the area treated, with the technique used, and precautions taken from the physician, more than the age of the patient. Normally we have few zones, they are known to be risky. First one is the glabella. This is a risky area because it's an end artery in this area, supplying this area. So the most common complication to occur here is necrosis when we do embolization of the artery. Nasolabial fold, also it's most common, most treated area, but it's the area known to have the highest rate of complications due to angular artery. If we inject filler into the artery, we may lead to embolization and we may need to necrosis. Another area that's now being commonly injected is the nose, because now it's the trend to do what we call this non-surgical rhinoplasty. Many doctors are injecting the nose just to get rid of the hump and to have slight elevation of the nose, without knowing that this is really a risky area. So the nose is an area where you have to know what you're doing to inject in the correct plane to be safely doing it. And especially that some patients are presenting after a failed rhinoplasty to do nose filler to correct this, and it's more risky to do it on a scarred nose. This is a dangerous area for sure. The temporal area is also a risky area for injection. Superficial temporal artery gives a branch here that may be hit by injection, and it's risky. The tear trough too is risky. If you go too medially, there are a network of vessels of connection between internal and external carotid arteries. Lips are dangerous too. You can just embolize the artery and by compression and have necrosis of the lips. So basically every area is dangerous. But these dangers, these vascular or necrotic complications, devastating complications, thank God they are not so common. So with doing some tricks, we can almost always avoid them. And if they occur, we have to know how to manage them. Firstly, knowledge. You have to know what you're doing, and you have to apply your knowledge for each area. In any aesthetic branch, you have to be delicate, you have to be gentle. You have to be injecting in the right plane, because when I know the artery at which depth it's passing, so I'm trying to avoid it. If the artery is passing superficial, I'm going deep to it, so I'm in a safer area. I like personally to use the cannula for injection. I feel it's safer. We have to take good history from the patients to know if they have history of cold sores, if they take blood thinners like vitamin E, like aspirin. If they do, we can defer the procedure to another time. But mainly you have to stick to proper technique. I think it's technique dependent or physician dependent, the complications. When you do your job in a correct way, you will really lessen the risk of complications in this area. Yes, for sure. First of all, I'm really amazed with the preparation here. And, everything looks perfect. The preparation is very, very well organized. And we are here to share experience and to learn. We always, when you go to conferences, we give our experience and we learn from others. Maybe one question from an audience will make a big difference for others and for us. I mean, it's what we like about medicine and about aesthetics, that there's always something to share between us. Even for experienced people who've been in the field for years and years, when we sit as doctors, we just share experience and how do you do this, how do I do this. So that's very important for learning. But we have to know that not everything you learn in conference, you have to apply it in your clinic the next day. You have always to refer to your own mind. I can get information from you, analyze it in my mind, and then apply it. This is very important because most complications usually occur the second day after conferences. You know, people are just looking what we did today and they try to apply it tomorrow without having the complete knowledge of this, and here errors and mistakes may occur.